Hi everyone, I'm Dr. Miriam Smith, DNP. Welcome to the Empowering New Nurses show. Again, I'm here to continue on the topic that I started my last episode, and that has to do with bullying. But today I'll talk about some of the negative impacts of bullying in nursing. Man, this is interesting. No organization at this time, when there is such a nursing shortage, would like to lose their nurses. And bullying can cause individuals to quit, can cause new nurses to quit. And if we say I'll talk a little on the statistical part of it. First, I will let you know that bullying in nursing, it threatens the safety of the patients. It also costs the organization a lot of money. It's expensive to replace nurses, to train nurses, and after training the nurses quit. That investment, that amount of work that have been placed in that nurse goes like that. So the organization has to start all over in recruiting more nurses. So it's costly. Then it can cause a high staff turnover. No one wants that. You want to know that individuals are comfortable, individuals are competent, individuals are there to render and give the best high quality care to the patients. And in doing that, the organization will shine. If the care is not at its best, it will definitely affect the organization. It will. Because instead of patients going to that institution or that organization, they will prefer or they will go to another place where they will receive the best care, which all patient needs. This is rather interesting because we don't want to have any high turnover. We want to develop, we want to have interprofessional progress, interactions that we will collaborate effectively, and that on the same page all our patients will receive the best care, and so the outcome will be phenomenal. The outcome will be what we're looking for, best practice. This is rather interesting. In these times, we don't need any bullying because it affects the institution negatively. Therefore, our nurses should be able to give the best care. Young nurses should feel comfortable in asking questions. In another way, the errors will be alleviated or lessened or mitigated, because you don't want to have that. You want the patient to receive the best care. Now, if the new nurse doesn't feel comfortable and is scared to ask any question when they're not sure, then there's a higher risk of making errors, which we don't want. Error is human. However, this should be lessened. Asking questions, there's no question that is stupid. Ask question to learn. And the preceptor or the senior nurse or the other nurse who knows should be willing to share. If one gives negative remarks against a nurse who's asking questions, that's gonna cause a nurse to sort of shrink and withhold what she would want to learn. So my recommendation at this time is that the nurse the young nurse or the second career nurse who is also new to the profession should come with an open mind, willing to learn. And it's on both sides, right? Because the new nurse should come with an open mind, but there are certain little tidbits that the young nurse should bear in mind too. You know, in this time of technology, you know, it's amazing, but at this time with the use of technology, you know, we learn from each other. Many of us, and I would say this, and I say it repeatedly, that many of the baby boomers or the senior nurses are not as, I'm going to use sharp in quotes, with technology. Some are very great, but some are not. So it's the young nurse, most times from my experience, they are just, wow, on top of it with technology. So they can write the notes very quickly, and some changes have occurred from my time, because we normally have very long progress notes, and now you have the computer. Our recordings are different, and there's a lot of check, but of course there's something out of the box that you need to document. You need to do that, but it's different. But many times they'll just quickly pick up certain things on the computer more than some of the older nurses, and that's okay. So we all need each other, and there's no need for bullying. So I just want to put thumbs up to my nurses who have been so helpful to our young nurses and helping them to gain knowledge and experience and skills. It's just fun to see where we were and where we are now. So just remember that, older nurses, that when you started, it's different now. And if someone was mean to you then, you don't have to do that to our young nurses. Share and just do the best, and it will come back to you. So our patients, at the end of it all, deserves the best care. All patients deserve the best care. Thank you for your service. Thank you for sharing, and no bullying. And if you see that, it must be addressed. If that is happening, it must be addressed. Thanks for listening. There in the hospitals, there are policies, procedures, there are information whereby that is definitely not part of the care of our patients. No bullying, because it definitely will affect the care of our patients and the job satisfaction and all of that. And our nursing turnover, we don't want them to be running from place to place. But if they feel secure, they will longevity, and they can grow, they can go back to school, they can excel in the area of their specialty. So thank you for not bullying. I'm Miriam Smith, and we will continue at some point and bullying. And please, if you have any question or any comments or any suggestions, feel free to indicate that. You can connect with me on Podcast Mayor, that's through Instagram, PodPal Miriam Smith, on YouTube, Miriam Amanda Smith. Thank you so much for just sharing and gaining new knowledge and expanding on the knowledge that you had, and our patients will be happier and will be healthier. And our outcome will be what we're looking for, because we have participated in best practices. Thank you. Have a great and outstanding, great day. Miriam Smith. Now, if the new nurse doesn't feel comfortable and is scared to ask any question when they're not sure, then there's a higher risk of making errors, which we don't want. Error is human. However, they should be lessened